All right, we're live. Good day and welcome to another episode of Any News Australia, where we cover topics concerning business, law, and the economy. We've got an extra special episode for you today, and we're fantastically honoured to be having Dr. Sam Bailey with us today. Dr. Sam doesn't need any introduction, but welcome to the show. How are you?
I'm really good. Thanks so much for the honor of coming on your show. I'm very happy to be here.
Yeah, fantastic. New Zealanders, I've got a soft spot for New Zealanders, I must say. I have spent some time there for work in the past and traveling around and representing our company over in New Zealand, and also some snow trips to Methven and Mount Hutt. And I
Yep.
must say that Flight of the Conchords are my favourite human beings on the planet, kind of thing at the moment. They're, comedic geniuses. So yeah, it's great. It's great to see. It's great to see New Zealand doctor, or well, any doctor actually, sort of speaking out the way you do, and it's great to have you with us. Um, so we, like I mentioned, we scheduled the live stream a couple of days ago, and it seems to have gone a little bit berserk on Facebook in particular, with lots of comments and things like that. But for those people who don't know much about you, can you tell us more about your credentials and what you've done in the medical space?
Yeah, sure. So I'm a conventionally trained doctor. So I went to medical school in New Zealand. I went to Otago Medical School. I graduated in 2005, and I worked in different areas. So basically, I worked in emergency medicine, after hours kind of type work. I've worked in general practice, and I've also done quite a lot of clinical trials work. So different phases. So when they run the human trials with new drugs, particularly in areas like cardiology, but to be honest, in all sorts of different medications. And that was my kind of one of my favorite areas of work. So when the vaccines came out, I was interested in them and how it was all going to play out. But yeah, so that's I finished. I actually was pregnant. I've just had a baby, and so I let my practicing certificate go about May last year. And so, but I'm probably not going to renew it. Well, I can't anyway because I'm not double jabbed.
All right.
that's
Yeah.
that's the new way apparently, is that you have to be double jabbed in order to be a doctor.
Yeah. So so just for the record, you are a real doctor.
Yes.
Oh,
Yeah.
do you consider yourself a conspiracy theorist nutcase?
Well, I mean, I think what's happening right now isn't a conspiracy theory. I would call it a conspiracy. So, yeah, I'm very open minded about things, and when people suggest things to me, I very much like to go back to the research and look at it myself, and I don't take anything at face value now. And so, when people suggest things initially, it can be kind of hard to accept when it's been something you've been taught, for you've practiced it for like 15 years or something. But now I don't take anything for granted.
Yeah, yeah, for sure. And we were talking a little bit before the show about when people have discussions with certain other individuals, and the first thing they'll mention is, "Are you a doctor?" And of course, for the large majority of us, that answer is no. But for yourself, and then when some of us refer to work that you've done, that someone like yourself has done, then of course they turn around and say, "Well, not that doctor." Um, it has to be another one of the other one approved ones, right? So I mean,
Yeah.
and you must be experiencing that sort of firsthand as well with the different treatment that you get from the authorities. Yeah.
Oh, definitely. And it's not just me. I mean, I'm connected with lots of wonderful doctors that are questioning the narrative at the moment. In New Zealand, we've got a group called the NZDSOS, which is New Zealand Doctors Speaking Out for Science. And I'm involved in that group. And, people are pathologists, GPs, hematologists, ophthalmologists. They're all sorts of different, come from different backgrounds, and all of them get the same thing. But yeah, I don't. My ego isn't so dependent on having to. I don't know. I don't. What I do, I don't really. Not that I don't care what people think, but I don't. I just I just go back to the research, and I want people to go and look at these things themselves and make a decision. I'm not trying to force my opinion on people. I've never tried to do that. People have to come to their own conclusions.
Yeah, I think it's a very balanced approach for sure. And I was noted that you worked on in New Zealand on some TV shows. The Checkup is one that I came across. And tell us about your time there and what happened with all of that. Yeah.
Yeah, shall I tell you my wake up?
Yeah, go ahead. Yeah, go ahead for
I
sure.
wake up from my deep slumber of medicine. Okay, so basically, like we're talking a little bit before, I had this business for a while. I was doing online, like an online doctor prescription service. And one of my friends actually said to me, Sam, you should do some vlogging. And I didn't even know what that meant. and I'm like, because at the time I was doing this TV show, I was a presenter for it, and I really enjoyed doing that. And she said, why don't you make YouTube, like be a YouTuber and make videos on health topics to drive traffic to your online business? So that's actually how I started getting into YouTube in the first place. And I really liked that kind of thing because it wasn't controlled, and you could look into anything. And then I started getting people ask. So COVID happened, so the beginning of 2020, and people would ask me about it, and they'd say, do face masks work? What's this about social distancing? And to be honest with you, Anthony, I didn't know anything about it. I didn't know. And I thought, okay, I can't just make up stuff. I have to go back and start looking into it myself. So that's when I did. I started, probably like you, I got obsessed and I was just huddled away in my little den researching and trying to understand what was going on and to make sense of it all. And I came across Andy Kaufman. Dr. Andy Kaufman, he's an American doctor, and he made a video, and it really kind of struck with me, this whole thing about, do viruses exist? And I was like, what? This is pretty out there. And little did I know what was going to happen to me. But so anyway, and then I got the book Virus Mania, which for me was a huge turning point because, and I'm actually a co-author of that, but before I wasn't. I just had read the book, and it talks about how all these pandemics that we're having are essentially pseudo pandemics, and you can see it. It's like a playbook for how COVID-19 happened. And so I was so kind of taken by this book that I started making my videos on these sort of themes. And anyway, in August of last year, so I'm halfway through making the second season of The Checkup, filming it. And at that stage, like on YouTube, I might have had, I don't know, like 80,000 subscribers or something like that. It was, it was starting to get bigger.
Yeah, and this is August 2021?
No, this is August 2020. So okay, yeah, sorry, the year before. Yeah, you forget how much time's gone by. So I had this contact who told me, who was running a PCR centre in New Zealand, in Christchurch, and she told me that they were getting more funding coming in from the ministry, and I knew that what was happening is that the cases were going up and down based on how much funding, about how many tests they were doing. And so I knew that around August there was going to be more cases that were going to happen. So I made a video about this, and I didn't really, and towards the end I talked about the vaccine, because at that point there was no, COVID vaccine, but it was coming. And I thought, there's no way, based on my own clinical trial research, that it's going to happen quickly. I thought it was just impossible, knowing how drugs are made. Anyway, so I talked about it, and I said, I'm not personally going to get a vaccine. All right. 2 weeks later, when this happens, it's like a bomb going off in your life, like it's stepping on a landmine. And I didn't realize how much of a landmine vaccines were until I stepped on that. So, okay, so within days, like of this 2-week period, a meme was made on Facebook from a political party, because at that time too, it was just about, election time, and there was lots of tension in the air. about that. So it was an opposition party, and they made a meme about my video, about what I'd said in it. Like, they didn't misrepresent it, but it was clearly a political kind of thing. I didn't even know who this political party was or anything. And then people are texting me saying, "You're in this meme and it's going viral." And I'm like, what the heck? You're trying to make sense of it. And
Yeah.
then literally, so that was on the weekend. And then on the Monday, I get in my inbox, I have an email from the medical council saying I've had all these complaints and they're going to investigate me. I had a phone call from the lawyer from the TV show saying, take down your video. And I remember I went up and talked to my husband. He's a doctor as well. And I said, oh my God, I'm going to have to take this video down, And he said to me, Sam, you know what you need to do. And it was a turning point. And I realized I can't do this. I can't have someone control what I say, my speech, because if once you let them in the door, then they control everything that you do. So I said no. And then they said, well, just cut out the bit on vaccines. And I said, no, I'm not going to do that. So they sacked me. And then I lost a job. Then my job that I'd had for 12 years told me to not come in anymore. And then I had about
and was that in a medical practice, was it? Sorry?
It was at a clinical trials, like a research group. And I see patients and look after them. And that was really hard because, they were my good friends. I'd worked there for a long time. And it was because of my videos. Anyway, then there was a fact check article that came out, and I didn't understand, then you know about fact check articles, but at the time I didn't kind of understand. I'm like, why is this happening? And then I had all these smear articles, like with all the mainstream news media, all coordinated, and it was clearly trying to discredit me. So it was a huge shock to the system, but I kind of recovered from it, and I by chance, one of the authors of Virus Mania reached out to me and said, do you want to interview, because there were these two guys, one's a journalist and the other's a physician, and the journalist said to me, do you want to speak with the physician on your channel? And I said, oh my God, you can't even, this is just magic for me, I'd love to. And then we got on really so well. He said, do you want to be part of the book, because we're going to write a chapter on COVID? And I said, yes, 100%. Let me do this.
Wow.
And then my life changed dramatically. And and I just continued on making YouTube videos. And the medical council and I should say with this, Anthony, that I think the medical council in Australia are much, much more severe than what we had in New Zealand at that time. And that's why I don't think there's been any Australian doctors really speaking out, because they would get in their, I guess, their practicing license, if they said anything against the council, what they were saying, then they could get the sack. So whereas in New Zealand at that time it wasn't, and they've become now they've suspended lots of doctors for doing kind of what I did. But at that time, they didn't know what to do with me. They just said, stop making COVID videos. You can talk about anything, but not COVID-19. And I wouldn't. And now they're still investigating me. And they're saying that I'm bringing the profession into disrepute. So there you go.
Wow. What a journey it must have been. And look, it's great that you had the support of your husband. I think that must have contributed greatly to, I guess, keep going with what you're doing, and we're all really happy about that as well. Before the show, you were talking about a period where you were the golden girl on the TV shows,
Yeah.
and so falling from that sort of pedestal must have been a big shock to the system as well, I'd imagine.
Yeah, it was, and not. It's funny, like when I got asked to do this TV show, and I was like, you get really flattered by it, and you're like, oh wow, they think I'm really good, and they want me to be on it, and I really enjoyed presenting. When you do these things, you don't even realize that this is something that you can do, and I really enjoyed it. But that I would be in the women's magazines and all that kind of stuff, and but actually, Anthony, I'm so grateful to do what I do now. Like, I don't care about all that stuff. It is not important. And I think being able to say free speech to me means it's more to me than anything. And I had that discussion with my medical boss. I said, you know, I said, what's important to you? You know, for me, free speech is everything. And if I can't say what I think, what are we living in? It's tyranny. So, and I've never tried to convince people of something. People come and watch my channel, you know, voluntarily, and I really try and encourage people to do their own research and come up with their own decisions. And I think that's part of what healthy debate, what science should be. And as you know, there has been no scientific debate with this. It's been one way or else, you know, and how controlled. And that's really a lot of what Virus Mania has been about too, is the coordination between governments, mainstream media, kind of elite specialists that are kind of handpicked to guide us and give us, you know, what we need to do as a population. And the amount of money involved, again, with Big Pharma. And you realize the corruption on every level within journals. And this is how this whole thing has come about, this medical tyranny.
Yeah, it's very interesting, and I think even from the discussions and the comments about this interview today, it seems so, and even in discussions that we have with people in general in the community, it's interesting that people that seem to be on, say, the same page as you, um, understand both sides, or seek to understand both sides of the argument, and then are making their decision. And a lot of time, it ends up in the place that you're. Am I? Is that
Yeah,
working now?
yes. Yeah, that's better.
Oh,
People,
I'm not sure what's happening. Maybe I don't know. The
it's
internet
okay.
gods of it. Anyway, so what I was saying, yeah, so people sort of, the majority of people I see on this side of the fence have considered both arguments. The people that, believe one side rarely understand the other side. And I think they've been trained not to even consider some of the other side of the discussion in some
Yeah,
of this as well. And I think it's much the same as, one person reads the Gandhi book, one person reads the Mein Kampf book, but the person that reads them both would probably have a better understanding of both of them, I guess, as well. And so
yeah,
it's very interesting to see that. So you're just on your YouTube channel. I mean, you're 310,000 subscribers now. And I think you're doing some great things there. You talk about everything from COVID-related issues to erectile dysfunction. I was just browsing for that one. Science versus
I,
dogma, and what a doctor's good for.
yeah.
And
Do you know when
over 90 videos. Yeah.
yeah, when I first started making them, I think it's to give it some reference. Like it was for my business. Like I did it for, so I made videos on like erectile dysfunction and things. And then and kind of maybe, you know, when you start a channel, you kind of, I don't know, trying to figure it out, and you're sort of working out what you want to do, I guess. And for me, it really took a little bit of time. And I think with COVID, I honestly didn't start it with this intention, I'm going to make COVID videos. I really didn't want to talk about it because I felt like I didn't know enough to sort of, I never, I don't believe in this term expert. I think it's, I really dislike it. And I don't, I just try and understand it myself, and then portray relay the information to people. And I think particularly with virology, again, that was something that we spent, a couple of lectures in it. In medical school, it's hardly taught, on the wards and things. You just learn infectious diseases, but you're not really taught virology unless you go down the infectious diseases route, which I hadn't. But at the same time, it's very complicated, and 99.9% of doctors don't understand virology. They don't understand PCR testing, and I had to learn that from scratch, but I thought, well, one thing I can do is try and help people understand it, because it bamboozles people, and really anyone can go and look into the stuff and understand it if they want to. But so I've really focused on that. And now, because of the censorship of big tech, like you can't talk about, the things that they don't want you to talk about, because it's immediately censored. And viral isolation, the existence of viruses, is at the top of my list of what gets censored.
Yeah, it's incredible. I had another question for you about all of that. So about a question has come in from Gary about terrain theory.
Oh yeah,
and what your
cool.
comments or ideas might be on that. Do you mind answering? I'll just put it up for you.
Oh yeah. Oh cool. Yeah. Yeah, I know. Yeah. So you're basically talking about clustering and things. Yeah. Okay. So hi Gary. nice to hear from you. I'm just FYI, I'm making a really good video. It's coming up on Wednesday, which is about why people are getting sick if COVID-19, if SARS-CoV-2 doesn't exist. So just that's really a good summary. But I think this concept of clustering, so I guess just really simply, terrain theory is this idea. So germ theory is the idea that you've got one microorganism causes one disease and there's one treatment. So as an example, for COVID-19, it's SARS-CoV-2 is the virus which causes COVID-19, and the treatment is the vaccine. And usually there's also one test as well, which is the PCR test. Anyway, whereas terrain is completely backwards, and it's this idea, which I think is the right idea, is that these bugs are around us, they're everywhere, and your terrain, your environment has to be sick in order for the microorganisms to come and do their work, and they do it to help us. So clustering is this concept where they'll find a group of people, and say you had, for example, a reunion dinner, and a bunch of army reunion people, and they all had the same meal, and 60 out of 100 had vomiting and diarrhea, and you go, okay, what was similar? The problem with clustering, and it's a good idea, this is the fundamentals of epidemiology, really, of how things how diseases happen. But one of the issues is nowadays everything is put down to a virus. So in that example, maybe there was something, a toxin that was in the food that caused people to be sick. But in today's world, now they say it's a virus, and it's the virus that has caused it. And then they will do some genomic sequencing or try and isolate a virus, and hey, yeah, that's the answer. But it doesn't, just because you get groups of people together with similar clusters of symptoms doesn't necessarily mean that it's from an infectious agent, and often it's not. Often there are multiple reasons, even reasons we don't understand. So and there are lots of disease examples where they used to think that it was caused by viruses when they're actually nutritional deficiencies. So for example, beriberi, pellagra, diseases that were shown to be nutritional, scurvy. At one stage, heart disease, heart attacks were thought to be caused by viruses as well. And I think the body has so many ways of responding to infections and or not infections, to when it's unhealthy, when things are wrong with it. And I also think psychological stress it's like people just ignore that. That doesn't make people sick. I can't understand this because stress and, within families, it's one of the number one reasons why people get run down and unwell.
Yeah, yeah, for sure. So I'll go back a couple of steps, and you mentioned there's a lot of topics regarding the current situation that you weren't familiar with, and you had to then go and research yourself. So,
Yes.
if you mind just describing what that process was for you, where do you find your information? How do you discern the information as to be factual or infactual or worth investigating further and so forth? Maybe some of us all here, we're all on our research path at the moment, or investigative path
Yeah.
at the moment. Maybe we can learn something from your process there
Yeah.
as well.
Yes. I guess so. What I normally do with any topic, so for example, chickenpox, I used to get lots of questions about how does chickenpox happen and chickenpox parties, and why isn't that a disease, or why isn't that a virus? And so I usually start off with going to like a mainstream source, like I'll go to Wikipedia or something and look to see where look at the citations of where things were first referenced, and then all I do is I go to scientific papers and I go back and back and back and back as far as I can go to the beginning. And sometimes it means reading like German papers or getting them translated and trying to understand. And I usually will go through the methodology of the paper to try and understand what happened. And then again, a lot of it was becoming familiar with terms, what definitions mean. And again, yeah, thankfully we have the internet, and I just search for those things. But it's drawing together, and I feel I am lucky in that having a medical degree makes it easier to read some of these scientific papers, and I worked in clinical research for a while, so it's just getting familiar with these terms, and probably like from an engineering background. If I were to read engineering papers, I'd need to school up on the jargon, but
Yeah,
and then basically build it from there. One thing I learned through Virus Mania was to write to the authors themselves of these papers and to question them, because they're the best people to tell you things. And also writing to institutions as well has been really helpful. And because, I, in honesty, I had all my vaccines. I had flu vaccine every year. I had vaccinated my kids, and it wasn't until 2020 happened, and I started questioning what was the purpose of having the COVID-19 vaccines if it came about. And I realized, just on a personal level, that I knew nothing about vaccines as a doctor. And unfortunately, again, 99% of doctors don't understand about vaccines, and it's a sad state of affairs, but that's what it is. So when you go to your doctor, they'll give you this kind of usual spiel, which I know because I was taught what to say, but it's actually, they've never really looked at the research themselves and gone back to the beginning, and also understanding animal studies. I mean, so much of these animal studies, they're awful, and in Virus Mania we talk about it as well, just what they did and how they're completely don't follow the scientific method. They don't do control studies. They don't. It's just they'll do it with small numbers, and they do these just terrible designs where they'll pour liquid down a monkey's throat and directly into the trachea, and then it causes pneumonia, and then they're like, oh wow, it's caused the disease. And it's like, well, if you did that to a human, you're going to make them just pouring liquid into the trachea directly. And lots of the studies are like this. They're bogus. And everything follows on from it, and it's dogma, and you can't question it. And if you do question it, people say, why are you doing this? Why are you questioning it? Yeah.
yeah. So, with all of that research, then I guess if you'd like to give us a summary on all of the different aspects that you've researched around the COVID pandemic, from masks to social distancing to everything else.
Yeah. Yeah,
open forum
so
for you to
I
let us know
guess
what the summary is for everyone. Yeah.
so sorry, do you want a summary of what I think's going on, or just the
Just all of all the different aspects. What has your research concluded in the area of masks and social distancing and vaccinations and
yeah.
the rest? Yeah.
Okay, I'll try and be quick. This is big topics.
I know
So
there's a
I
lot
get
there. Yeah.
just unpack it for us, Sam. um, so yeah, I guess masks have no evidence for them whatsoever. I personally, just also a little bit going back, but I don't like to use a lot of the terms because I think you're just buying into the language, then you're buying into these ideas. Um, the fundamental thing for me, Anthony, is that I have not seen any scientific evidence for the existence of SARS-CoV-2, and therefore, based on that, my follow-on is that there is no indication for things like COVID-19 vaccines. I think what's happened is there's been a reclassification of existing diseases by this bogus test, which is a PCR test. And not that all PCR is bad. I always like to say PCR has a role, but I think it is terribly misused, the interpretation of it, for infectious diseases. And that is why we're seeing case explosions, because if you test, you'll find cases. My research has also moved into what is genomic sequencing, the processes of that. And again, it is a little bit complicated, but essentially these things are in silico. They're computer generated hypothetical sequences. And Stefan Lenker, if you're familiar with his work, he's done some amazing stuff where showing that these control experiments that they do, you can find the same results without a virus. So basically the types of scientific experiments that they're showing to prove that these viruses exist, you can do in control experiments with yeast, for example. You don't need a virus to do this. So yeah, that would be my general, and I think there's lots of factors. Again, my video is probably a better unpacking. I'm shocking in interviews to try and think on my feet and get it out properly. But there's the fear narrative has been this has been a psychological fear game for people. People have called it, a pandemic of fear, and I agree. I think so much of the behavior that we're seeing in people, mass formation, what Matthias Desmet talks about, these things are very real and they have impacts on people's health as well. My plea is for people to look into the stuff about virus existence, because I don't believe this is the end of it. I think once COVID-19 ends, there will be never-ending viruses that are threats. And unless kind of virology itself is shown to be inaccurate, I think we're as a globe, as a society, we're going to be subjected to this continually, and that's why my feeling is I'm very much strongly focused on that and trying to expose for people to understand themselves why virology, the lies of it, really.
Yeah, for sure. And for those of you who aren't already familiar, you can go to YouTube and look up Dr. Sam Bailey. It comes up straight away. Subscribe to her channel. She does explain things very clearly and comprehensively in a very easy to understand manner. I think you're one of the most entertaining people talking on these kind of technical topics in healthcare and stuff that I've come across as well. So it's a very easy to watch show. I hope you all sort of go there and support her channel as well.
Yeah.
And
If you,
we'll
if
talk
you,
about the book now. Yeah, sorry.
Oh,
Go ahead.
yes. I was just going to say quickly, if people want to watch like my good stuff, probably the best place to go is my Odyssey channel, because I don't post COVID-19 things anymore, some topics on there anymore because of the censorship, because I got about 6 videos taken down at once, and it's just really hard to guess what's going to trigger the algorithm, so strike algorithm. So yeah, if people want to find me, that's probably the best place. But yeah. Sorry about the virus mania. Yeah. So and I I guess. Sorry, do you want me to just talk or?
Oh no, no problem. I guess the link for the Odyssey channel we'll send through a link shortly, and I'll put it in the comments for everyone to
Yeah,
sort of click through and get through to the Odyssey channel as well. And
yeah.
yeah, and now Virus Mania. You tell us about the book.
Yeah, so I guess I know I'm an author in it, but before that, I was already plugging it because I just liked the book so much. But I think for people to what I like about it is it talks a lot about terrain theory in it, and that was my first introduction to terrain theory. I didn't even know about that prior, and the problems of where germ theory has come from and why it's so entrenched in us as a society. It really is like we're taught, from young ages to wash our hands, to do all these things, and it's this fear of germs that they're out to get us when actually they're our friends. So one of the things, it goes through a lot of the pandemics. So for example, bird flu, HIV and AIDS, and HIV and AIDS is very much kind of the prototype for what's happened with COVID-19 for people that are familiar with HIV and AIDS. It's very good. It works through, and you can see how COVID-19 kind of happened. But also it goes back to the original experiments of things like the Spanish flu. There's really interesting stuff, and it's not written in a super technical way. It's written so that anyone can read it and understand it. We're actually making the book into a documentary as well, which is really exciting. We've crowdfunded to get the first 2 episodes doing, so we're just in the process of turning that into. It's going to be all
Wow,
broken up into,
exciting.
like about 7 episodes, I think. So yeah, if you can, I also turned the book into an audiobook. So if you don't like reading books, I definitely the audiobook's good, and just me talking for 15 hours of Kiwi accents, if you can put up with that.
I'm
But
sure
yeah.
it'll be an easy listen. Great. And where can people buy the book from?
Yeah, so and if you're in Australia, check out the Nile. I think it's thenile.com.au. Just look up Virus Mania and you'll find it. It's probably the
Is that just
best place.
THENILE?
Yes, yeah. You can get it on Amazon, but I don't know. If you don't want to support Amazon, I would go to the Nile. Yeah. .com.au and
Is that the right one
just
there?
look up
Yeah.
Virus Mania. There should be some reviews on there, and yeah, check it out. It gives you a really good overview of the corruption of yeah of what's happening with big pharma governments, and the big question of vaccines, and talks about masks, all that stuff as well. So it's a really good summary.
Yeah. Great. Buy the book. I think I'm going to buy a copy of the book. But some final things we wanted to talk about. We're sort of 30, 40 minutes in. What's your opinion of some of the things happening in New Zealand at the moment? And also, what you know of what's happening here in Australia? Question: where do you think things might be going from here, and what can people do?
Yeah, really good question. So yeah, at the moment in New Zealand, yeah, it's sort of interesting times. It feels like 2022 is a little bit of a turning point with things. So at the moment for us, the big new change is that they've introduced, I'm sorry, I'm not familiar with Australia with the mask rules, but New Zealand, they used to have, so it's masks for adults essentially, or children over the age of 12 had to wear masks to go places unless you have a mask exemption. Now they've changed it to children must wear masks from the age of like 8 and upwards at schools. That's happened, started today kind of thing. The schools have gone back. Obviously the vaccine's been rolled out from ages 5 to 12, which is very concerning. And unfortunately, I mean, I hear a lot of the stuff early because I'm kind of connected, with people that are in the know, but with it. So, I have grave worries about that, obviously, in children, what's going to be happening. But yeah, I think there's this really interesting, there's a big movement, what they call Voices for Freedom, which is it's a huge movement actually of people basically not going along with this and forming kind of parallel societies essentially. And I do see that as kind of what's coming. But yeah, in terms of Australia, I've got some of my best friends and family live there actually, and I've been. It's just been awful, and particularly like we are talking about earlier, I think the police brutality and what's going on in the Northern Territories with the health minister there. I can't understand, but I'm not sure what your thoughts are on it, Anthony.
Yeah, so we were actually a part of a documentary crew that attempted to get into Northern Territory to find out exactly what was happening, but we got into regional New South Wales, and we've seen very similar things happening there. Maybe not exactly the same. We were going to do an episode on Any News with some interviews that haven't quite happened yet, but yeah, it seems to be terrible. I think the confirmations we're getting of what was going on is heartening to consider being in Australia during this time as well.
Yeah, so you broke
All
up a
of
little
that,
bit there, but yeah. Um,
yeah.
yeah,
Sorry,
you're
what was
back,
I
yeah.
saying? What was the last?
that you that you gone into the New South Wales and you were trying to film and get an episode done there. But yeah, it sounds like there are various different freedom movements and things, which yeah, I think that's the future. And I mean, it's so hard. I kind of hate speculating, but I just feel like from an individual perspective, what can you do? And I just say what I do myself, and that is I don't get any vaccines. I don't do any testing. I don't do the QR scans. We have Vax passes here as well, so it's becoming increasingly difficult for someone like myself. I can't go to like a restaurant or anything because you need a Vax pass, and more private businesses are electing. They don't have to, but they are going along with this. And I just boycott businesses that go along with it. I'm just like, no, I'm not doing this. And I teach my kids that as well. But I do think I see more of this concept of parallel societies. And I think either people are going to be within this health matrix, hooked up constantly on pharmaceuticals, a vaccine conveyor belt, and people being sick in that system, and basically the doctors and health workers affiliated with that, they have to go along with it or they don't get paid. So people have to be aware of this. But I actually think for health, you don't need all the stuff that they're offering. It's not a recipe for health. And once COVID-19's finished, my big focus is I want to try and make videos about health, about really how to help yourself and how to be well without all this kind of nonsense. But yeah, being more reliant on like lower tech type healthcare, people getting back to nature, growing their own food. But I think it's going to be a bit of pain, that we've got to go through. And I think we'll get there. But I have a lot of optimism and hope about the future. But I think everyone has to like not go along with it in terms of you have to speak up and use our voices, which I think is what makes us different from animals, our free speech, being able to, that's what the elites and, some of the cabal are the most afraid of is our voices. And I've experienced that firsthand, where they try and shut you down because they can't argue you.
Yeah, for sure. And it's very interesting when you talk about freedom of speech, essentially restricting what noises you can make with your mouth. And I think once you are able to restrict effectively someone's speech, then actions become very easy after that too, right? So it's a slippery slope to total control. And I think you can see through social media some of the ways that they do thought control as well, the things you're allowed to think about, the things you're not allowed to think about, the things you're allowed to see and witness, and the things that you're not, which is all part of the same discussion, really, anyway, isn't it? I feel. So, look,
Absolutely.
yeah, I think you're the second person on the show. Lyndon Clark, a few days ago, was also talking about recreating parallel systems so that we have access to the resources that we need moving forward. So, yeah, I think that's great. I think I'm saying that's something we should all start considering as communities and working together to do those types of things for sure.
Yeah, and like you said about the different kind of groups, I think that that's been for me one of the most positive things. Like I know that sounds strange, but I'm grateful that this happened because I was asleep and it woke me up, and I'd rather be awake, even if it's bad. I'd rather know what's going on than not know. And yeah, for me, it's like you being able to connect with so many cool,
Absolutely.
just inspiring people and thinking, this is real. This is what life is, and all this other stuff that we're shown on mainstream media, and it's just I turn off the TV. But I mean, I'm sure most of the people that are watching you are already well ahead on that, but that would be my first thing to do.
Yeah, for sure. We've got a few more minutes. If there's anyone online that has any comments for Dr. Sam, send them through. And we'll see if we can answer them. Or maybe, I mean, you've covered a lot of ground, and if there's anything you need to understand, you can always check out her Odyssey and her YouTube channel as well.
Yeah.
Um, yeah. Any final comments then before while we're waiting for them to maybe come back with some
Oh,
questions?
no, yeah, people always talk about, what's coming, and I think, it is that the dark before the dawn, and I think we are in a really tough time, and I, like you, I have a very, very soft spot for Australians, and I think, Kiwis and Australians are so similar in that respect. So yeah. But yeah, in terms of the Novavax, do you want me to talk? Yeah,
Yeah. We've got this question for you. Yeah. Thoughts on
yeah,
Novavax?
yeah. I don't know what your rules are, and I know, for example, lots of people are looking at things like Novavax instead of Pfizer and stuff because of
Well,
uh
it's very interesting. So I'll jump in quickly. It's very
yeah,
interesting. Just a couple of nights ago at a dinner party, we were talking about Novavax, and it's being marketed as the vax for anti-vaxxers, and which sounds like a very paradoxical or oxymoronic kind of statement. But yeah, I'm not sure. I mean, but I don't have a medical opinion in any way. Just talk about how the media is describing it. Yeah.
yeah. So I guess yeah, I like what I was about to say. I think people are looking, particularly in New Zealand, are looking at things like Novavax because then they can have the vaccine and get a vaccine passport and participate in society. Get around it that way without having the potential risks. My personal view on these is I don't think there is reason to have any of them, and I strongly believe that because of my views on the existence of SARS-CoV-2. The trouble is with all of them is that we don't know any of the long-term effects, and my personal opinion is I'm not taking any of them, and I also don't want to go along with technocracy, fascism as well. I'm not doing a vax pass. I'm not doing any of that. So I can understand, and I mean, I'm not trying to be judgmental. I know people are trying to work and get an income, and fully, I understand that. But if it was me, I wouldn't get any of them. Yeah. So, but yeah, this is the test we're being kind of put under at the moment, and I know doctors that have completely, they've been suspended, they've lost everything, but they're doing it because they know, that they're very ethical people that know that this is wrong, what we're being subjected to, and the only way we can get out of it is not to comply. It's you've got to not comply in order to help everybody.
Yeah. Very interesting and very wise words as the final comments then. Thank you, Dr. Sam, for joining us today and
No,
taking
thank
time out
you.
of your busy schedule. All the best with the Bubs and Little Man. What's his name, by the way?
His name is Aston.
Aston.
Yeah,
Great.
it's like the car, but it wasn't actually named after the car. He's it means from the east, which I really liked from a spiritual perspective. So
Oh,
yeah,
fantastic. And you say he's 5 months old now, coming along well?
yeah, he's thriving. He's a big boy. He's up at night, but I love him, and yeah, no, he's really cool. Yeah.
Fantastic. Thanks again for coming on the show today. I hope you all enjoyed that, everyone. A shout out to my volunteers that work behind the scenes to put this together for you, and all the viewers that send us the love through to encourage us to keep making more of these videos. Brady Gunn, the guy who started Stand in the Park, is with us on Wednesday at 7:30. So tune in for that one. That'll be great. And Dr. Sam, if it's okay, I might reach out in the future sometime. I might have you back on the show in a few months, depending on how things go. Maybe there could be some other things to discuss.
Perfect. That would be a pleasure. Thank you.
Great. Thanks again. Thanks, everyone.
Cheers.
Catch you soon. Bye.